Okay, so here we are looking at you from behind. The question is there any jugular vein compression? And before we could even get there, we see that this atlas is significantly tilted up to the left, and we have this calcification on the left here. And you can see up in there how this calcification goes all the way up to the skull. Here we have you turning your head to the left, so you would expect the atlas to go towards the right. You can see how the calcification moves away from the skull there a little bit. Boy, it got twisted, didn't it? Okay, and you can see how much the vertebral artery is compromised. And then there's the neutral position, and there, when she turns her head to the right, you can see how that calcification touches the bone and bottoms out against the skull. Okay, now we'll go back over here, back to neutral. All right. And we'll start removing some of these structures. Moving around to the front. We have a styloid that is calcified. You already know that you don't want to bring your head down because it triggers you. And this jugular over here is going to get entrapped when you bring your head down. And it looks like it would start entrapping pretty quickly. You don't have to bring your head down much for that to start happening because of this excessive calcification in there. And what is it we're looking at? It looks to me like it is the rectus lateralis capitis muscle on the left that has been calcified. Now, we've made other videos of other people that have had a ligament calcified because of repetitive injury, and this looks like this muscle has been calcified from repetitive injury, or it's possible you were born with it and then had a trauma and the thing popped off. So we really, truly don't know which it is. But we do know that this calcified bone in there is really giving us trouble when it comes to holding the adjustment and the mechanics of moving the neck around. All right, so you had gotten prolotherapy and done a lot better, and then you were carrying a backpack and or doing some other weights around the neck, and here we can see that the first rib has gone down on both sides, particularly the left side. You can see that first rib has gone down and is dug into the bone there a little bit. So we made an adjustment on that today, and we want to see actually Dr. Hauser do prolotherapy in through there and tighten up those ligaments on both sides and lift that rib up. What else do we see here? Let's back out. The hyoid bone seems to be retracted. We see that with whiplashes. Let's see here. All right. So the hyoid bone's a little crooked, and it is contracted back behind. Actually, look at that, significantly back, even to where it's back at the same level as the jugulars. So we want to have either myself or somebody do some physical therapy to pull that out, work on the compartment, contracted anterior compartment there. Let's see. We have other injuries in here. We have a hyperextension where the C2 went into C3, causing a compression fracture in there, denting in there. That mechanically is going to play out in some way. What am I missing? Anybody have any questions? Yeah, when we had you turn your head to the left, we saw that let's see, 2, 3, 4, 5, 6 on 7. This vertebra is moving way too fast, so it seems as though you can see the space there. That basically your left, when you turn your head to the left, most of the rotation seems to be occurring at the atlas, C1, C2, and all the way down here. The rest of them don't seem to be turning so much. That was it, and that's the thing that we noticed. Even when you turn your head to the right, it still seems to be rotated to the left and not wanting to close correctly. All right. This is an addendum. She was a competitive cheerleader, won national championship, as a matter of fact. She's the one that they threw up in the air. So how much of this is from being thrown up in the air and the trauma? Well, here's one of the things. The mechanics are such that this extra facet, extra calcification, is hitting the back of the head when she brings her head back, or to the right, and I'll show you that in a moment. And this extra calcification in here, when she turns her head to the right, it makes contact and looks like it's trying to punch a hole in the back of the head there. There's also another hole, and actually what we'll do is we'll look at it this direction. So if I decrease the calcification, you can see where she's trying to make two holes in her head, right here, here and here. This one is the one that calcification tries to punch through when she turns her head to the right. The other one, I can't seem to make it make contact with its, whether left rotation, right rotation, neutral, nothing. So it's possible this is where it used to be attached and there was an avulsion fracture where it pulled away, or just when she was getting thrown up in the air, it was making contact and putting a hole in there. Let's go and look at right rotation. So here we have right rotation. We have that extra calcification, that pad making contact with the back of the skull. You can see that going right in there. We'll bring that out. So here, when I remove the calcification, you can see right here where that little part of the atlas is trying to poke through. There it is. And in the neutral position, that hole is empty. Then when we look at left rotation, we see this calcification moves away from the skull. When anybody turns their head to the left, the atlas goes to the right. That's just natural motion. So it obviously is going to move away from that. And it moves away from the skull there as well. I just thought that deserved extra detail.